edit out the first part.
Yeah, is it falling or like do you need more support for it?
We're good.
Okay.
It's running.
Hi. Alrighty. So, our study focused on the effectiveness of the social skills training program in improving social participation in patients with traumatic brain injury. So the purpose of the study is basically the title that I just stated. Basically, testing the effectiveness of a group treatment program based on social skills to improve the social communication deficits that you may see in individuals with post-TBI. The study also focused on improving social integration in the community and satisfaction of life of these individuals, but for the purpose of this assignment, or for the purpose of our clinic, we're only focusing on social participation. So the method in the form of the PICO question, the patients are individuals with post-acute TBI. The intervention involved a 12-week group treatment program based on social skills. The comparison was deferred treatment, and the outcome, improved social communication skills. The level of evidence is level 1 because it was a randomized controlled trial with deferred treatment, which makes it stronger. The follow-up was at 3 months and 6 months and 9 months. There were 52 individuals participating in the study, which makes it strong evidence. And the patients involved were at least 1 year post-injury. And the intervention again lasted 12 weeks, with each group session lasting an hour and a half.
All right, so our inclusion and exclusion criteria, there were quite a few things. So the inclusion criteria, the participants had to be adults between the ages of 18 and 64 who had experienced a TBI previously. They must have been discharged from a TBI rehabilitation program with a moderate to a severe TBI. They must be at least 1 year post-injury and be on the Ranchos Los Amigos level of cognitive functioning, be at least a level 6 or above. They must demonstrate receptive and expressive communication skills, functional to be able to participate in a group. The participants must also demonstrate sufficient recall of day-to-day events to help with the learning in the group setting. They have to be, and their participant, they must have significant others or family members that indicate that they have some aspect of social impairment, and they have to be able to provide informed consent for participation. The exclusion criteria, they were excluded if they reported significant behavioral concerns such as low frustration level or behavioral and anger control, or other medical conditions or issues that would affect their group participation. They were excluded if they had a diagnosis of a significant psychiatric or psychological disorder, or a history of current alcohol or substance abuse. And they were also excluded if they had a significant motor disorder, which affected their ease of speech for group participation as well, or their need for physical assistance. Okay, so the intervention description, again, they met once a week for an hour and a half for 12 weeks. There was an 8 participant limit in the groups just to help with the group dynamics, provide time for individual participation and processing. It was held in a living room type setting, so a natural environment for these individuals so they could be comfortable. The intervention followed the social skills and traumatic brain injury workbook for group treatment. Group members were given copies of these workbooks and asked to share with family members who assisted throughout the process of the intervention in their participation. The curriculum was based on 4 key components. The first one was the use of co-group leaders from at least 2 different disciplines. So it could be an occupational and a speech therapist, a physical and a speech therapist, etc. The second one was an emphasis on self-awareness and self-assessment. The third one was the use of group processes to foster interaction, feedback, problem solving, and social support systems. And the fourth was being able to generalize skills addressed through the involvement of family and friends and completing assignments in the community and at home. Okay, further intervention description. So the first several sessions just focused on simple self-assessment, setting their goals for the groups and the program, and learning about the skills of a good communicator. The middle sessions targeted learning goal-specific strategies, giving and receiving group feedback, and participating within the group and at home. And then the later sessions toward the end of the program worked on generalization of skills and general social problem solving skills. They also went on one group outing for a session to practice social skills in the community. And the final session was a review of their goals and progress, group closure, and sharing of their successes and future recommendations with the families. So again, the family members and significant others played a major role in this intervention.
So the outcome measures used in the study, there were a lot of outcome measures used. The study used one objective, one subjective, and one subjective measure of social communication skills, and those measures are listed in your notes section. But for the purpose of implementing it into our clinic, we'll focus only on the goal attainment measure because that's the measure that showed statistical significance. Another measure that's important for implementing this intervention is the Social Communication Skills Questionnaire Adapted version, and that's used as a screener for the referrals that the clinic will receive. So I'll go into more information regarding the goal attainment scaling on the next slide, but the secondary outcome measures used in this study involved assessment of social community integration and measure of life satisfaction. So the goal attainment scaling is used to develop the goals of the individual participants with the assistance of the group leaders. The family is also involved in creating the goals of the patient, but the goal attainment scaling is based on a 5-point scale, and it is reported to be a sensitive measure to change. So it's perfect and ideal for measuring to see if your participants are reaching those actual goals. And I have an example here of a sample goal. I will ask more questions in the conversation. As you can see, it's broken down into, I will ask questions in 20% or less of conversations. I will ask questions in 30% of conversations. And in your notes section, there's like a little practice session of what a goal will look like and other examples of sample goals that can be used. But the goals are expressed objectively and in terms of concrete, achievable behavior that can be observed and recorded. All right, so the actual outcomes in the study revealed a significant improvement from the baseline measures and also post-treatment evaluation. So there was a significant improvement in social communication skills according to that goal attainment scaling assessment. An additional thing, the goal attainment scaling, the evaluation was completed by the participant, the significant other, as well as group leaders. So we combined all that input from each individual that's important in the intervention.
All right, so our clinical guidelines and recommendations, these are just kind of steps that we would implement in our clinic if we were to make this an intervention. So the first recommendation is in reference to the referral of patients. So the rehabilitation and community facilities that are referring the patients with the TBIs are going to be given a summary of the supporting evidence, so why we are wanting to implement this intervention. And then after reviewing the evidence, they're going to be asked to refer patients that would fall under those guidelines and the inclusion and exclusion criteria. Number 2 is that any interested qualified therapists, so again, the the speech pathologist and the OT or PT, any combination of 2 people, are going to attend a 1-day workshop on the workbook for the program. The registration fee is going to be covered by the OT manager, and as proof of competency, the therapists are going to have to achieve at least an 80% on that test to prove competency, and they'll be given a certificate of completion for that. The next one is that the qualified therapists are going to need to also demonstrate competence in the screening assessment as well as the GAS. So they're going to be given those manuals and asked to administer and score them in mock sessions so that they can demonstrate their competence and also score at least an 80%. And then they're also going to have to do a written test along with that mock trial. And then once they pass those, they're good to go. The 4th step is that if they fail to become certified, they're going to be given at least one option to reattend those workshops and show competency. And then if they still don't do that, then they're not going to be given another chance. They're going to be given one extra time to try to pass, and then after that, the clinic is going to have to try to find another therapist, just due to the shortness of the program and trying to find therapists that can become competent quickly. And they have to become competent at least 2 weeks prior to the beginning of the program. The OT manager is going to keep record of these certifications, and the next step is that once they're competent, patients will begin to become referred, and they are going to start screening those patients to include them in the program. All right. The next step is that once they've identified patients that are going to become a good fit, they're going to start the group sessions. So again, each group session will be an hour and a half for 12 weeks, and they're going to strictly follow that workbook, that social skills and traumatic brain injury workbook for all of those sessions. And they're just going to be given copies of those workbooks to take home and work with family members with. Then the therapists are going to follow the outline of the sessions that we talked about previously, but each session is going to have a total of 6 general steps. So they're going to review the homework from the previous session, introduce the new topic, have some guided discussions, work on some small group practice, group problem solving and feedback, and then receive their homework for the following week. And then the therapists are going to go on that one group outing that we talked about to practice social skills in the community. And the final session, they'll have a time for review of goals and progress, have some closure, share their successes and things like that, and just a general encouragement of family participation as they go forward.
So family participation is very huge in implementing this intervention. So the therapists will be encouraged to encourage family members to be involved as much as possible. So the OT manager will ensure that each therapist is following along the course, the workbook provided, and ensuring that they are demonstrating competency in providing the 12-week group intervention. And after the 12 sessions, the therapist will again use that goal attainment scaling to evaluate the patients on their actual goals created. The therapist will evaluate at 3 months post, 6 months, and 9 months. Both the caregiver and participant input will be incorporated. As I mentioned before, the feedback from the therapist, the caregiver, and the participant is important in that goal attainment evaluation. And the manager will keep the results of the evaluation in the 3-ring binder as a reference. If any therapist shows incompetence, then the OT manager will audit them and make them re-attend the workshop or demonstrate competency. So the OT manager will be on top of that, ensuring that the proper intervention is being implemented. All right, and our plan, criteria, and audit tool will give a few examples of the steps that we created in order to implement this into our clinic. So one example, the recommendation of the rehabilitation will be given a summary of the supporting article and intervention plan, and this is just for the referral process. So we'll provide the rehabilitation facility with this study and information of the intervention, and the rehabilitation facility will refer patients based on that inclusion and exclusion criteria from the study. And the rehabilitation facility will be asked only to refer patients that they think will be a good fit for the intervention. So the criteria for that is just the rehabilitation facility actually receiving the supporting article and intervention plan. The OT manager will keep a list of the patients referred and who referred them. And a compliance plan set will be the OT manager reminding the rehabilitation facilities to actually refer the patients based on that criteria. And in the event that a new rehabilitation facility becomes interested in referring patients, the OT manager will send out the summary of the article, intervention plan, and explanation of the current process in place.
All right, our second example is that is addressing the therapist attending the training for the workbook. So the implementation plan for this recommendation is that the OT manager is going to enroll the therapist in that course. The criteria for that recommendation is that they have to obtain certification as proof of competency. The way that they're doing this is that the OT manager is going to check the certificate and make sure that that certificate is maintained and in a safe place. They're also going to confirm the presence of the therapist during the program, that they're actually there implementing it, and making sure that they actually attended the workshop. And then the compliance plan for the therapist is that if they fail to obtain the certification or they choose to leave the study, they're going to have to find a new therapist to attend the training program. And that if they miss the first workshop or don't prove competency, then they will be offered one more workshop. And after that, they're going to be asked to leave the study and a new therapist will have to be found. And the last one is regarding the therapists. Once they have achieved competency, they're then going to study the GAS with the manual and show competency in that, in a written test and a mock trial. So for implementing that, the OT manager is going to purchase the manuals, they're going to study the GAS and practice them on each other, and then they're going to perform it for the OT manager to prove competency. The criteria for this is that they have to score at least an 80% on the written test and on the earn approval from the OT manager for the mock trial, and the therapist will then be considered competent in it. The way that they're going to do this is that the OT manager is going to update just on their lists the names of the therapists who proved competency and keep that in a binder, and then those who don't meet the criteria are going to be given another chance to retake the test, but no other opportunities will be provided after that, kind of along the same lines as with the workbook. That's it.
Alrighty, that's it.
The end.
The end. Sorry if the words were cut off, but we'll send the PowerPoint to you. Bye.